Well, a lot has changed in our clinic's 100-year history. The one constant has been an unwavering dedication to patient-focused care.
Our philosophy is that we spend more time with people, provide more comprehensive care, that they're going to get better faster.
I think what's great is that we have the functional side of things. So we've got chiropractic, physio, but then we also have a naturopathic doctor and a traditional Chinese medicine doctor who are able to look at more of the internal side of things. So hormonal imbalances, digestion, allergies, and while that's very different from the manual therapy, it's so essential to a holistic approach to health and well-being.
We know best care is never provided by one single type of practitioner. So to have multiple types of practitioners under one roof, all working towards one goal, can really streamline a patient's efforts and energy.
Part of the collaborative nature of our clinic is that it's collaborative with the patients themselves. We want the active individual who is, motivated to become better, and it's not just come and receive something. We have lots to offer, but it's also putting in the work and, learning how to do rehab exercises, learning how to move their bodies properly and well, then see the enhanced benefits that come from that. And so I think that's where we get really excited, is when we see somebody who is just as invested in their well-being as we are as healthcare practitioners.
We have multiple areas of entry into the clinic. One of those can be more the sport therapy side of things. And again, an athlete can be anyone. Someone just wants to perform better or live better or be stronger. And then we have a few branches of kind of specialized programs within that. One of them being concussion management. We introduced this program several years ago, kind of out of the need that we saw this gap in proper management of concussions. We had several patients that were struggling with them and tried to make referrals and realized that what was being offered out there really seemed to be subpar. So we partnered with Shift Concussion Management and some training and started to offer concussion management through our clinic. Right, so a concussion can be really devastating for someone, for their family. If it goes on for a prolonged period of time, they struggle with work. Various other forms of disability can affect their relationships and their finances. And so being able to work with these patients and really give them a strategy and the education and kind of that reassurance that they can get better and that brains do heal has been really rewarding. Functional range conditioning, or FRC, is one part of the functional range systems. It takes people from a joint-by-joint thorough assessment to any kind of manual therapy necessary to regain mobility in joints and soft tissue, and then it conditions those joints and soft tissue. So the FRC simultaneously focuses on mobility, joint strength, and body control. It's very effective, very rewarding and challenging program that Dr. Menta offers out of our clinic. He's one of Calgary's few sports specialist chiropractors, and he's really passionate about working with athletes. And one thing about this program is it does take time, and because he's so passionate about it, he's very excited to offer his time to those patients that are looking to put the work into it. We started offering an acute knee clinic because we recognize the challenges that are out there for people to get timely access to a knee assessment following primarily traumatic knee injuries, but also with arthritis or degenerative conditions or soft tissue injuries like runners get. Knee injuries are really common. It's quite a delay through the public side to get into a knee clinic. So having private alternatives where we can do a thorough assessment and we can provide that whole gamut of diagnosis, assessment, treatment, and return to sport.
Something we hear often from our patients is, "You have done way more for me than I've ever had anywhere else." So just the amount and the depth of the assessment and the treatment is already in the first visit way beyond their expectations. And so to continue building on that care.
For us, that's helping people to live more active lives. So if people feel better, then they can move more and become more active. And we know that is very closely correlated with quality of life and longevity of life.
So if someone hasn't been to Ascent before and they're looking to be stronger, recover from an injury, we would love for them to come in and have the Ascent experience.